How's it going, everyone? Welcome to our session today. We're just going to give a minute or two to let everyone come on in. Welcome, everybody, to our session today. We're just going to give another minute to let people come on in. Bill, if you want to share your screen, I can go through my couple slides
Absolutely.
and then introduce you and turn it over to you.
Wait, let me start the slideshow. Okay.
Go to the next slide for me.
Oh, and the next.
Okay. Okay, so welcome to today's session, the 988 Mental Health Call Line, an overview for mental health providers and educators. This webinar is sponsored by the Northeastern Caribbean Mental Health Technology Transfer Center, or MHTTC, housed at Rutgers, the School of Health Professions. My name is Sean Karzak. I'm the evaluator of this center, and I'll be introducing our center today and our webinar presenter. Okay, next slide. The MHTTC is funded by SAMHSA, the Substance Abuse and Mental Health Service Administration, to enhance the capacity of behavioral health workforce to deliver evidence-based practices to individuals with mental health conditions. We also address the full continuum services spanning mental illness prevention, treatment, and recovery supports. Next slide. We offer a wide range of services at no cost, and much of those are hosted on our website, which I'll post the link to that in just a minute. Next slide. If you're interested in staying up to date with our events and products at the Northeastern Caribbean MHTTC, please sign up to receive our email communication. You can sign up by scanning this QR code, or I will put a link in the chat in just a minute. Next slide, please. So following the webinar, you'll be asked to complete a brief survey. We very much value this feedback and use it to improve our activities and inform future activities. The survey is also important because our continued funding is linked to this completion. So we appreciate that and thank you for your feedback. Just want to remind everyone that we are recording today's session. It'll be posted to the website within 7 days of completion. Next slide. At the time of this presentation, Miriam Delphin Rittman is serving as the acting secretary for the mental health and substance abuse at SAMHSA. Experts here are of the speakers and do not reflect the official position of Department of Health and Human Services or SAMHSA. Next slide. The MHTTC network is committed to using affirmative, respectful, and recovery-oriented language in all of our activities. Next slide. Okay, so we got through some of our background stuff, so let's begin our training today. Today we have William Zimmerman with us. Bill currently serves as the Director of Crisis Services for the National Call Center at Rutgers University Behavioral Healthcare. He's a licensed clinical social worker, earning his Master's of Social Work from the School of Social Work in 2006. He's also worked in behavioral health settings and acute systems of children, adolescents, and adult populations. He's been involved in the past decade. Here's a statewide suicide prevention hotline in 2030. He's the interim managing entry for and publicly funded system disorders in 15. So now I welcome Bill and turn it over to him.
Thank you, Sean. I don't know, it looked like we had some difficulties with the audio. Please speak up in the chat if you are noticing some audio difficulties. But thanks everybody for being here. I'm glad that you're here. I took a quick look at the list. I see some familiar names. If you were here last year around this time, some of the content's going to be the same. But there's going to be some new updated developments that should be pretty interesting for you to hear. I'm grateful that you have an interest in learning about not only the 988 hotline, Suicide and Prevention Lifeline, but also an interest in doing what you can to raise awareness, the help that is out there, and the cause of suicide prevention. Right. If we're all Rutgers employees, every time I see the email from Dr. Mania about the passing of a student, I wonder about the circumstances. We were going all the way back, throughout the years. We've had numerous losses throughout the country, throughout our community, and suicide is a painful and confusing, traumatic event, right, in the lives of anyone who knew the person or knew of the person. So this is what we're going to hopefully cover today, right? In terms of, what evidence there is that there's an ongoing mental health crisis in this country. What is the 988 Lifeline? What are the services vision of the 988 Suicide and Crisis Lifeline? What's the network? Some statistics. How does it work when when I dial 988 or now I can text 988, what happens? What's the difference between 911 and 988? There's a couple of practice scenarios that we would certainly welcome your input on and feedback on and participation in. And then we'll definitely leave some time at the end for questions. So if you have a question that you're hoping to have answered, right, please feel free to put it in the chat. And then before we wrap up for today, we will be sure to give the best answer or try to point you in the right direction. Okay. Okay. All right. So what is your role, right, in this, right? Most of us here are educators, staff members. I'm not sure how many different roles that we have represented here today throughout the Rutgers, community and beyond. But if you want to pop it in the chat, we've got these three questions here. What is your role, right, in terms of 988 Lifeline and suicide prevention or crisis intervention? How familiar are you with 988? And has it been helpful, to you, to someone you care about, or to someone that you provide services to? If you want to take a minute, put it in the chat. We'll take a quick look here. Okay. Andres, I see that, yep, there were some issues with the sound. I'm hoping that that has resolved. Okay. All right. Discharge planning. Excellent. We're hoping that the 988 number is on every, discharge set of discharge instructions that someone is issued at the time, and then also all transitions in care. Okay. So, okay. Some lack of familiarity, which is great. First time you're hearing about it. Okay. Okay. I'm glad you're here. Oh, wow. Okay. North Dakota. Okay. Welcome. 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 Okay. Right. Very good. All right. 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 Thank you all for introducing yourselves here. I appreciate that. Educating people. I see mental health providers represented here in the chat. Someone from a call center. That's good. I'm working at a call center now. I've been here for the past 10 years. Right. Wait times for 988. Yep. Yep. Okay, Dr. Skippy is here. I see this. Very good. All right, and Meredith. Okay. Oh, wow. We've got representation from far and wide here. All right, Nebraska in the house. Right. All right, so a wide variety of, Minnesota. Woo. All right, a wide variety of representation here. So I'm glad Missouri. Whoo, I had no idea this was such a global audience here. So different levels of familiarity with 988. Okay, and some feedback, right? That we're still seeing, news articles about, well, what happens if I call 988? We're in the midst of some national and state awareness raising campaigns for 988. So let's dive in here. All right, so why do we need 988? Well, unfortunately, I'm someone who argues that suicide is a public health issue, and it's something that represents crisis proportions here. Right? In 2022, we saw 1.6 million adults attempted suicide, which is a reduction from the 1.7 million in 2021. It remained consistent that there was approximately one death by suicide every 11 minutes. The 2022 data was over 49,000 people died from suicide, if I'm not mistaken. And when you think about that number, what does that represent, right? I'm not a sports person, but I did a little research, and that is a capacity Major League Baseball stadium in a big market. So where the Mets play over in Citi Field, in New York, that's an entire stadium plus of people who died by suicide in 1 year. Right? Tremendous loss. Right? Um, the final 2021 data has suicide in the top 10 leading causes of death for age groups 10 to 24. 25 to 44, and 45 to 64. Important to note, there's only six, categories. There's only six age groups. So 3 out of the 6, suicide remains in the top 10. It moved out of the top 10 overall. I think back in 2021, for a long time it was in the top 10. So we're heading in the right direction, right? But we still have a lot of work to do. And we saw almost 108,000 people die from drug overdoses in 2022. So 988, it's got a pretty ambitious vision, right? It's the suicide, mental health, and substance abuse crisis lifeline. Right. I think we're still seeing research about the impact of the global pandemic, the psychosocial stressors that have resulted from that, the lack of availability of mental health services and care, the lack of funding to support mental health services, right? If you look, you see articles about, why I chose to not participate in networks as a mental health provider because it detracted from providing care, right? So access is a problem, enough providers is a problem, and the stressors continue. So I think the data is clear that this is a public health crisis. Right. So the 988 Suicide and Crisis Lifeline. Give you a little bit about a little bit of history about that. All right. So 988 has been around in one form or another since 2005. It used to be called the National Suicide Prevention Lifeline. You probably are familiar with that. It was 1-800-273-TALK, right? There was some congressional action that put into place the 988 Suicide and Crisis Lifeline. It went live in July of 2022. It was July 16th. I remember that day when we switched over, right? The previous number is still going to work. So you can still dial 1-800-273-TALK or 1-800-SUICIDE and still reach the lifeline. But we figured that a 3-digit code is going to be a lot easier to remember if someone is in acute crisis. Okay. So, like I said, it's 24/7 free confidential support to people in emotional distress or suicidal, mental health, or substance abuse crisis for anywhere in the U.S. states, territories, and tribal regions. Right. So we want everyone in the country, to be able to access the mental health system of care and the crisis continuum care. So this was, supported by the FCC and Congress, designated 988 as the 3-digit calling code for the Lifeline, and it rolled out, went live July 16th in 2022. Okay, right. So you can call or text 988, right? Or you can chat online at 988lifeline.org. Okay, so there's a chat interface on the website there. Now, if you remember, 911 hasn't been around forever, right? And it took quite some time for 911 to become available in all the U.S. states, territories, and tribal regions, right? So this is a pretty rapid rollout for 988, and at present, I believe all phone carriers are in compliance with this. Okay, so how does it work, right? So since the July 2022 launch, the Lifeline has received over 10.8 million contacts, right? I should have updated this graphic on the right. My apologies, folks. It's in a later slide. So they're given 3 options, right? What happens? I dial 988 on my phone. It rings. I get this IVR menu that says press 1 if you're a veteran and would like to connect with the Veterans Crisis Line. As we know, our service members and veterans are at an elevated risk of dying by suicide, higher than the the general population. They represent about 13% of all deaths by suicide, yet they only represent about 6 to 7% of the population at any given time. If you speak Spanish or would prefer to speak Spanish, you can press 2 to connect to the Spanish subnetwork Lifeline. Right, so we're all part of this one large network. It's over 200 independent crisis centers. Rutgers, we house 1 local state queue. So if you're from New Jersey, you can get through to us. Or there's 4 other centers in New Jersey. Actually, I'm sorry, 3 other centers in New Jersey right now. We just had 1 drop out of the network. And then there's a system of backup centers that if the local center doesn't answer in a pretty brief period of time, it rolls over to a backup center. The goal is to have everyone who's in crisis, their call answered as quickly as possible, because we know that the longer people have to wait in crisis, the higher the chance that they're going to disconnect and not be able to get the help that they need. Okay. The third option here is you can connect by pressing 3 to the LGBTQI plus group for support. If you're under 25 and you identify as a member of the LGBTQI plus community, you will be routed to a sub-network that specializes in providing support, resources, and assistance for this population who's in crisis. Okay. So like I said, after you press your prompts, you could just stay on the line. If you're just going to, go to the general network of crisis centers, your call will be routed to your local crisis center. Right? And if that center is unable to answer, right, if there's a complicated technological network here that figures out all these routing tables and everything, if your local center can't answer your call, it rolls over to a national backup center. Okay. Now, if you were here last year, we told you that the way the routing works is by your cell phone or your landline's area code, right? Now, we know in today's society that just because I have a New Jersey phone number doesn't mean that I am currently living in New Jersey, right? So the overwhelming majority of people were referred to local crisis centers, right? But those who had a phone number, an area code that didn't reflect their current geographic location might have been routed to somewhere that's not geographically close to them, right? So I moved to California, I'm out there visiting a relative, and I call 988 from my New Jersey number. I used to get routed to a New Jersey center, which is going to help, but they might not be as familiar with the local system of care and the local resources that can be provided, or maybe even the access criteria for those local services. So this has been identified as an area for improvement. And just yesterday, the 17th, actually, was it yesterday? Or was it 2 days ago? Oh boy. On September 17th of 2024, Verizon and T-Mobile implemented what's called geo-routing of 988 Lifeline calls and texts. So that means that it uses the cell phone towers to figure out my general location. It's not geolocating. It's not like in 911 where it pops up what my address is on the screen, right? It's a geolocation or geo-routing system. So when I dial 988 or text 988, it's going to route me to my closest local crisis center, right? So we're making progress here, okay? All right, so that's going to be exciting news. Verizon and T-Mobile make up about 50% of the overall volume of cell networks in the country. AT&T is going to be making this switch in the pretty near future, and every other carrier is going to have to make this switch in the very near future. Right, so we're making progress here. Okay, your voices have been heard. If that was something that you, like me, always raised some concerns about. All right, so additionally, people who are deaf or hard of hearing can also access the line from a video phone, right? So there's a video phone that if you go to 988lifeline.org, there's an access point there to direct you to the video phone, okay? All right, so the majority of contacts that come in are calls, right? But we're seeing a rapid increase in the amount of texts that come in, and an attendant increase in those under the age of 25, right? So if you're here as an educator, right, chances are your population is largely under 25, not wholly. You know, I went back to school pretty late. But we're going to see increases in the number of texts to the 988 Lifeline, right? Right. Next slide here. All right. So there's 3 pillars of 988. This is the messaging from SAMHSA, right? All right. The 3 pillars are someone to talk to, someone to respond, and a safe place for help, right? We're really in the middle of a change in our crisis continuum of care here in the U.S., right? Oftentimes, you know, one of the first questions that people would ask if they called the line, they would say, "Are you going to send the police to my house?" Right? Um, we are moving away as a nation from emergency personnel as the only tool to respond to someone in mental health crisis. Right? Right. The overall aspirational goal is for a comprehensive and robust crisis system, right? And that's these 3 pillars. Okay. We want to provide that crisis care that's needed anywhere in the country. And we know that, you know, depending on where you live, right? Not like here in New Jersey, where I'm like, how many hospitals are in my county? You know, the nearest hospital might be hundreds of miles away, right? So we want to be able to provide crisis care, right, to people who are in crisis with the least amount of delay. Okay. And we're going to see national rollouts throughout the country. There's been a ton of funding allocated to this transition, and we're really going to see this is an opportunity, I think, a once in a career opportunity to see a change in the way that our crisis system of care operates throughout the country. Okay, right. Right. So we want to deliver a full range of crisis care services with mobile crisis teams, which is the second pillar, and stabilization centers, which is the third pillar. That's a safe place for help, as well as connecting people who are in need to the tools and resources that are going to help not only with their current crisis, but help prevent future crises, right? Right. The public health model of prevention, right? This is, I think, part of the vision of 988 here. Okay. All right. So, you know, it's going to take some time, right? Just like 911 and emergency medical services have grown over the past 5 decades, right? We're going to expect a much faster 988 transition to meet the demand for 24/7 access. And we're going to help, you know, the people in need by trained counselors helping people with suicidal thoughts, substance abuse, and other mental health crises. Right? It's a pretty lofty goal, right? It's a pretty wide net. The kind of thing is the no wrong door. Right? You're in substance abuse crisis. We can do some brief assessment here, get you connected if we need to, right? To whatever the substance abuse system of care is. I think it cut out when Sean was talking about the interim managing entity. We launched that here at Rutgers University Behavioral Healthcare, funded by the state of New Jersey. And that's the single point of access for the publicly funded substance abuse system of care in New Jersey, right? So we make some referrals back and forth. We've partnered with 211 in New Jersey. We have transfer protocols between our centers and the 211 center, interoperability. They transfer to us, we transfer to them, because sometimes those concrete service needs are what's driving the current crisis. Right? So we want people to have access to all pieces of what's going to impact their overall wellness and success. Okay, so we are seeing these crisis contact centers, the first pillar, someone to talk to, right? The 988 centers, as the essential component of a broader crisis continuum of care, right? So we got, on the least restrictive and least costly is the person in crisis picks up the phone and makes a phone call. The data suggests that about 70% of all 988 interactions are resolved by that initial interaction, right? That they don't require any additional support, right? I think it used to be that, if you called your provider after hours, it was going to be like, please call 911 or go to the local emergency room if you're having a crisis, right? Which we know is expensive. It's restrictive, right? Like you go to your local screening center and you're like, I just need to talk to someone. They say, okay, come on in. Sometimes the door locks behind you and you go, what did I just do? Right? And it can create this dynamic that I think diminishes help-seeking behavior over the long run. Right? I'm not saying that you can't, provide patient-centered care in a secure setting. People do it all the time, right? But if the patient wasn't prepared for that, it can have an impact on their help-seeking behavior. Okay, so we want 988 to be a part of this robust crisis care system, links people to community-based providers who can deliver a full range of crisis care services, including these mobile crisis response teams, which we're going to talk about, crisis stabilization centers, which are different from what we currently have in New Jersey. And you, in your state, I know we have wide representation here. You may have active crisis stabilization centers in your state that are, launched and successful or in the process of launching, and also wraparound services, right? The goal is to have this full continuum of services available to anyone experiencing a behavioral health crisis, right? And we really want to reduce the reliance on police, EMS, emergency departments, hospitals, and jails to address these crises. I'm sure I don't have to remind anyone, anytime there's a fatality involved in an emergency response to a mental health call, tremendous tragedy. Right. We know we just had one in Fort Lee, not too long ago here in New Jersey, and it's not just an isolated incident. We know that it happens on a regular basis. And I believe that nobody wants that to happen, not law enforcement, certainly not the family of, the person in crisis, certainly not the person in crisis. So this is part of reducing that reliance, right, on emergency personnel. Right? It used to be kind of like the only tool, 911 had in their toolbox, right? You call 911, they're like, you need fire, EMS, or police. One of those three is going out, right? So 988 is going to provide an alternative to that, and we operate under the least restrictive, most cooperative model of intervention, right? Not to say that emergency personnel is never the right response. Sometimes it absolutely is, right? For a suicide attempt in progress, our job is to initiate life-saving measures, right? So we can get that person stabilized and go on to get the help that they need to try to resolve whatever it is that brought about this reaction. Okay, but we also don't want to see people languishing in emergency rooms, right, for dozens of hours, sometimes more than days, to be discharged with a sense that I didn't really get the help that I thought I was going to get when I came here, right? It's because we have a system that might not have had all the pieces in place to provide the support and help in the least restrictive environment. Okay, right? Because we know emergency room care is the most expensive kind of care that there is, right? We want to try to utilize that when it's needed, and avoid that when it's not, right? Like I said, 70% of contacts to the Lifeline are resolved with that initial interaction, right? So what happens in the other part of the time, right? Mobile crisis teams. We are rapidly approaching the ability for 988 centers to dispatch mobile crisis teams to any county in New Jersey. Right, this has been part of the planning process. New Jersey has adopted, the SAMHSA model here, the 3 pillars. Mobile crisis team RFPs went out last year. They've been awarded, they've been being built, and they are getting ready to launch. Right, so if during your contact or your patient's contact or your loved one's contact with 988, it's agreed by both parties, right, that the phone call wasn't enough, but the emergency room isn't needed right now. There's going to be some in-between steps that are now available that hadn't previously been available. Right? New Jersey funded these teams. We've got 9 areas. I think there's over 62 people teams. One is going to be a trained crisis intervention specialist. The other is going to be a peer support specialist. And these teams of 2 are going to be able to be dispatched for those situations where a phone call isn't enough, but the emergency room is too much, or an emergency response is too much. Okay. That's coming very soon. In fact, there's going to be some limited availability on the 23rd. That's the launch date that we're going to be able to have access to this service in New Jersey. Now, it's got to go through 988 centers. It can't be, it's not accessible to the general public. But if you dial 988, right, we can access that level of service. And again, free of charge. Phone call is free of charge. The mobile crisis team there's no billing associated with that, as far as I know. And I can't speak to the crisis stabilization facilities, but I also know that those have been RFP'd, awarded, and are in process of being stood up now in New Jersey. There's going to be 5 regional crisis stabilization centers. And from what my understanding is that these are not considered to be secure facilities, right? But there's going to be more on that. So this is in development. So there's going to be an unfolding process of that. I would defer to your own state's system of care. I know there's some states out there who have, all 3 of these services already stood up. Some combination of the 3 of them in process of being stood up. For some reason, I think Nevada is in the process of standing up their crisis stabilization centers, if I'm not mistaken. I think we just got some correspondence from them. So it's going to be an exciting time with a lot of changes. And is it going to be the smoothest ride? I'm sure it isn't, right? Any of us who've stood up a program know that there's some bumps and there's a learning curve, right? But I think we're heading in the right direction where, we're going to see fewer instances of someone who sought help, who, had an emergency response, and then somehow the situation escalated and someone got hurt or there was a fatality. Okay, so it's an exciting time here. Uh-oh. Snapshot of the 988 Lifeline. Okay, that one's supposed to be blank. All right. So when I call 988, what's happening? Right? There are over 200 independent local crisis centers that make up this network. Right? The 988 Lifeline is the grant originates from SAMHSA. There's a grant administrator, which is Vibrant Emotional Health. They're based out of New York. They used to be called the Mental Health Association of New York City. They're now called Vibrant Emotional Health, and they have been the administrator of the Lifeline grant for at least over a decade, if I'm not mistaken, right? Probably even longer than that. So their job is to kind of develop this network of independent providers to handle all the routing and the phone side of things, who gets where, make sure they're getting to the right spot, and also to develop best practices. So they do a wonderful job of that stuff, right? So as I mentioned before, calls aren't routed by their area code for at least 50% of the traffic now. Now they're getting routed by their location, right? And then we're going to see even more, right, as the years go on here. Okay. All right. So let me see if this adds. Boom. There's our map. Okay. So there's the map of the 200 plus crisis centers throughout the country. Right. You can see some states, Iowa, Idaho has one. Right. Arizona has one, Nevada has one, and then some states have a bunch, right? California has a bunch, Florida has a bunch, New Jersey right now we have 4. Rutgers operates 24/7. The other 3 operate somewhat less than 24/7, but we are working on making sure we have the most coverage, so anybody who's in need can get access ASAP, right? And I was at a conference earlier this year. Canada now has their own 988 lifeline. So we're seeing the expansion of these efforts to other nations around the globe. Okay. All right. All right. And then to overlay, right? One of these has to be updated. Yeah, contact of Burlington over here, down here by Cherry Hill. They are no longer in the network, but the other 4 remain the same. There's contact of Mercer, which does calls, chats, and texts. There's Rutgers down there in the middle of the state, which does right now calls, but we're going to be adding 24/7 chat coverage before the end of the year. And then up in the northern regions, we have the Mental Health Association of New Jersey, which is going to be working 7 days a week, answering calls and chats for a smaller percentage of their time. And then Caring Contact of Westfield, they each of these centers handles a certain geographic region as a primary, and sometimes they have a secondary coverage region. So we've got some great partners here in New Jersey. We're all working together with the state and with the mobile crisis teams. We just met with them earlier today. So we've got our 5 agencies providing mobile crisis teams in the 9 regions, those 60 plus, teams that are getting ready to be come online, and we're working together as a system here to implement this vision of 988. Okay. Bear with me one moment. All right. So here's the graphic that I should have replaced earlier. So 2 years later, right? We've been 988 has been around for 2 years now, right? The first year was a blur. It happened so fast, right? So the line has had over 10 million contacts since going live in July of 2022. Text volume increased by 51% just between 2023 and 2024, right? And in July of 2024, there were over 400,000 non-veterans crisis line calls, almost 53,000 chats, and 155,000 texts were routed to 988 from around the country. Okay. And of those 10 million contacts in the last 2 years, 1.7 million were texts, right? Chats went down a little bit because I think the chat interface, you got to go to a website to get it, where now if you could just, text 988 from your phone, it provides you with, I think, a greater amount of freedom. Right. We would talk to people from chat, and sometimes with newer counselors, it's a little uncomfortable. And they're like, well, can we call you? And the feedback was always that no, if they wanted to call us, they would call us, right? Chatting and texting is a way for you to get some support where you might be in an environment where you don't want people to know you're in crisis, right? Maybe you're sitting in a classroom and struggling. Maybe you're sitting upstairs in your room, at home with family members or roommates who are nearby, but you just had a major blowout with that, has got you stressed out, and you want to be in touch with someone who can support you. but you want to do it in a way that's even more private, than a phone call. So I think that the text, I think, is only going to increase, and we're only going to get better, I think, at providing support and empathy through text. Right? There's a whole skill set that's involved in providing, empathic responses and supports through the written word, and we as a nation are going to get better at that. Not saying we're not doing a good job, but it's like the next frontier, right? Because you miss all that stuff. You miss the eye contact, you miss the tone of voice, if you're talking to someone over the phone and you know that they're listening and they care. It's a lot easier to discern that. I think you have to be more intentional if you're responding via the written word. Okay, so the numbers are good, right? Everything's heading in the right direction, and a tremendous investment, right? You put $1.5 billion into something, you're going to want to see some results, right? And we're seeing some results here. Okay, and that 1.5 is in the crisis continuum. Those are the three pillars. The crisis centers, the mobile crisis outreach teams, and the crisis stabilization centers. So a tremendous investment, in the mental health well-being of our country here. Okay, all right. So the 988 vision, someone to talk to, right? Like I said before, several times, the vast majority of people who contact the Lifeline, they're able to be helped by the crisis counselor. What the crisis counselor can provide, or the connection or referral made to community resources. Most callers are significantly more likely to feel less depressed, less suicidal, less overwhelmed, and more helpful after speaking to a 988 Lifeline crisis counselor. And this is based on research, right? There's a research component to this 988 system here. Okay, uh, less than 2% of calls require connection to emergency services. All right. In fact, we're seeing, right, even less than that over the last couple years here, as we see more focus and attention on adhering to the least restrictive, most cooperative model, right? And I would say about half of the time emergency personnel are involved, it's voluntary, right? It's agreed upon between the crisis counselor and the person in distress as, yes, that is the intervention that I would like to happen now. And we do some prep work with people, right? Our job as 988 counselors is, if there is an emergency services intervention, to try to walk the person in crisis through steps, to minimize, right, the chance that there's that something goes awry. Don't answer the door with your cell phone in your hand, that kind of thing. It's dark out, shiny objects, make sure when you answer the knock, you don't have your cell phone. If there's a porch light, put the porch light on, that kind of thing. Are there animals? Make sure they're secure, that kind of stuff. We want to work with people to increase everyone's safety. Okay. Okay. All right. So this is kind of like the natural flow of what happens during a call, right? The connection is probably one of the most important pieces here, right? We want people to feel like they connect with their counselor on the other side of the phone, and that's part of the training, is how to develop a connection. We know, right, that one of the most significant factors of treatment being helpful is the relationship with your provider, right? That's a significant component of whether or not treatment can be effective. Right? We want to assess the immediate risk. Our counselors are trained to do that kind of early in the conversation, right? We want to make sure if it's suicide in progress, we're aware of that, but not before we establish a connection, right? We want to listen, clarify, and plan. And sometimes we kind of, have to, it's a circular process where we have to revisit things. This is very much client driven. Okay, we want to make sure that we ask open-ended questions, get a real sense of the person being heard. Right? We want you to feel heard if you call or chat or text 988. Okay. All right, and then once we've gotten to the point where we've made a plan, and sometimes the plan is just you'll continue to use the 988 Lifeline if things get this bad. You know, maybe you have a therapist and a psychiatrist, but at 2 o'clock in the morning when things got overwhelming, you needed to reach out, and we were there, right? And we helped you through this rough patch, right? We can offer follow-up. It's kind of limited and focused, right? We're not looking to build a caseload here at 988, right? There's other programs that maybe we can refer you to if they exist in your community, right? To kind of have an ongoing, support, right? Sometimes there's peer support programs. And then we're going to move to wrap up, right? I mean, calls, the average of calls is probably anywhere between, 10 and 13 minutes. And that's from people who, kind of hang up right away to people who you're on the phone with, throughout a rescue for, over an hour sometimes, if not more. And chats and texts can take even longer than that. The research indicates they last about 3 times longer than a phone call. Okay, so we talked about this, right? This is just, we want to connect with the person on the other side who's in crisis. We want to assess their immediate risk. And we want to listen and clarify, make sure, hey, what's going on? What is it? Which I hear you talking about multiple stressors here. Which, if any of those, did you want to try to make a plan for, right? Like I said, client-centered, right? Offer follow-up where it's indicated, right? Not everyone gets offered follow-up, but if you're someone who's been having suicidal thoughts in the last 24 hours or at the time of the call, we want to offer you a follow-up. None of this is mandatory. If you say, no, thanks, I'm good, right? It's voluntary, right? And then we'll move to wrap up the call and reinforce that, hey, the Lifeline is here 24 hours a day, every day of the year. Who answers the call? Like I said, there's independent crisis centers, right? Sometimes there's state laws about who can be called a counselor, right? So there's varying staffing requirements. So it's really, it's like herding cats, right? In terms of all these crisis centers with all their different state regulations, right? That impact these things. Here at Rutgers UBHC, we've got our line staff who are, mental health specialists. They've got experience in. We prefer people who have experience dealing with crisis or acute care, right? We've got mental health professionals who provide supervision around the clock. So there's always a licensed clinician who's on shift to be able to consult with and provide direction, support, and guidance to our line staff. And then we've got multiple layers of consultation available, right? Our executive director, General Mark Graham, we've had many people, visit our call center throughout the years that we've grown. In the pandemic, we expanded when other programs were shrinking. And it's been pretty impressive to those who have not seen the call center in terms of the number of different programs that we operate and the amount of people that we help every year. Right, over 500,000 calls, 500,000 calls each year we field here at the National Call Center at Rutgers UBHC. And then there's standardized training on engagement and assessment, right? Vibrant, they're developing the best practices, right? So all staff have to go through some basic similar training. So we all kind of come at this thing from the same angle, and we all have the same level of training. So you get a standardized product, right? That's what we want. We don't want things to be radically different if you call back and get a backup center as opposed to your local center. Okay. And then, during the call, right? Any kind of emotional distress, crisis is self-defined, right? So if you call us, what's a crisis for you might not be considered a crisis for someone else, right? But we're here for anyone in suicidal, mental health, or substance abuse crisis or emotional distress, right? And some of the limitations, right? We really don't intend 988 to take the place of formal treatment if that's what's indicated, right? If there's a potential mental health disorder, right? We want to try to educate people about that. Hey, some of the things that I'm hearing you saying, could be depression. Did you want to try to figure out if there's someone you could talk to about getting an assessment and seeing what your options are if you are depressed, right? And we really don't want it to replace coping skills or primary or social supports. Now, sometimes people's social supports are unavailable, right? And sometimes their social supports or primary supports are the people who are contributing to the current crisis, right? But we always want to build people's resilience and their level of participation in the recovery process, right? You got to participate in your own recovery, right? So that's what we want to foster that. Okay. All right. So if you need more than a call, right, we can provide some limited follow-up, right? Usually there's a plan in place, right? But we'll check in with you, a couple days after the initial call, right? If it's more of an urgent matter, we're going to try to provide you with some referral and linkages as needed, right? So the higher the acuity, the level of urgency, the level of danger, the more coordination that we are going to provide for people. And then our last intervention, after all less restrictive options have exhausted, and there's about 7 different less restrictive options that our staff are trained to try to work through and introduce, is if there's a suicide in progress or an imminent risk of suicide, that we sometimes have to involve rescue to save a life, right? So and again, the research is that less than 2%, I would say it's probably even closer to less than 1.5% of calls result in any kind of emergency response, and about half of those are voluntary. Okay, so I know we're getting short on time here, right? So 988, there's provides, when do we call 988 versus when we call 911? All right, so 988, if you need immediate support for emotional distress, someone to talk to, right? An understanding, compassionate ear, right? Or text, right? Okay, so 98% resolved at the first point of contact. That's a little different than the statistic that I cited. Um, and a very small percentage require an activation of the 911 system. Okay. When do we want people to call 911? Right? If there's limited resources for de-escalation or emotional support, right? They don't have the ability to do that on 911. They're like, what do you need? We're going to send it to you, and then we're going to go on to help the next person, right? So that's not something that they have in their resources to provide, right? For a life-threatening emergency, you know, um, if someone calls and says, my friend, loved one, whoever just locked themselves in the bathroom and said that they took a half a bottle of Tylenol to try to kill themselves, right? That's where we need someone to get out there soon, because the sooner we intervene, the better, right? Or someone, they're going into the bathroom, locking the door, and they've got a razor blade or a loaded gun threatening to kill themselves, right? That's when we want to have 911. Right? Like I said, 988, while the calls are geo-routed, they're not geolocated, so we don't know where anybody is, right? When they call us, right? It's voluntary. As much or as little as they want to share with us, we're still going to try to help them. Right? And 911, they may have the ability to dispatch a trained crisis intervention team. I know here in New Jersey, we have CIT training. At the police academies, and at the county level, we do this. There's I think it's a 2-day seminar, CIT, where providers from mental health agencies get together with newly inducted officers, in their training. Maybe not newly inducted officers in their training, and they work together to educate about mental health crisis and how to intervene. Right, and some officers that I've worked with over the years are awesome at this, at de-escalation. Okay. And finally, we have this Arrive Together program, right? In New Jersey, it's sponsored by the Office of the Attorney General, and it's by municipality or department, and where it's a uniformed, or actually, they might be plainclothes officer arrives with a mental health professional to do the intervention, right? And I know different states have different models of crisis response. Somewhere out there, I remember hearing where a paramedic from the fire department, and a social worker go out to respond to calls, right? And that seems to work pretty good. So different states do things differently, but we know that when time is of the essence, we really want to have that emergency response from 911 rather than 988. Okay. All right. So, you know, these are all the components, right? We got policy, we got corporate support, we got emergency services, service organizations and advocacy groups, every coalition meeting that we have, At the state level here, we've got representation from NAMI, there, people who want, the peer voice, the loved one's voice, the family member's voice. We want people to, to be representative of a larger coalition. So everyone's voice can be heard here, and a system that can be built that is going to help the most amount of people. Okay. All right. So, we are getting close on time here. There's a couple of scenarios, right? This is one of those, audience participation times. So we'll probably run one of them. I don't think we'll have time for two and some questions. Hi, as a medical student, feeling very overwhelmed by the coursework. Parents wanting to become a doctor for as long as he can remember. Came to your office, shared he's having difficulty focusing on his coursework, staying up till 3 a.m. studying, hard time focusing on the readings, feels like there's no point anyway because he won't understand it. He's afraid to disappoint his parents, feels like a failure, and guilty for not being able to make them proud. Says he's been feeling pretty hopeless, isn't sleeping well, and hasn't had an appetite for the past few days. He says he's been thinking about doing something drastic to relieve the pressure. Right? So audience participation time here, real quick. Any kind of suggestions on what the next steps might be to help this young person? I'm going to pop open the chat here so I can see. Okay, let's see. Clarity on what he means. Absolutely. Assessment, right? Further assessment, right? Call 988. We get plenty of calls from people who are considered third parties, right? Like my friend said something or texted something or posted something. It's got me kind of worried. What should we do? And we can walk a third party through what questions to ask, educate them, right? See some good answers here. Move into assessment, right? If people introduce suicidality into the conversation, pick it up and go with it, right? Don't be afraid to use the word suicide. Have you been thinking about killing yourself, right? It's a myth that asking someone about suicide is going to put the idea in their head, right? Be direct, right? Use the words, Asking about stressors, absolutely. Acknowledgement, absolutely. Validation, right? When in doubt, validate, right? Self-care, absolutely. Yeah. Right? Any kind of emotion, any kind of, provide some treatment and support there. Columbia model, that's a great, the CSSRS, QPR, that's another wonderful model. You don't have to be, a clinician to use QPR, right? Question, persuade, refer, excellent models. We have lots of options for those. Okay, trainings for those is what I should have said. Excellent answers. I feel like your students and peers are in great hands. Okay. Right. All right. All right. I feel like in the interest of time management, I want to skip the next slide. Right. Okay. All right. We got some resources here. The 988 Partner Toolkit. We got the Follow-Up Matters, right, website here. I also, one of the things that I wanted to do for you all is SAMHSA's got a store that you can order 988 materials, and the materials are free and the shipping is free. So I want to pop that into the chat so you can all have that. And the turnaround time is pretty good, right? You can order a decent amount of materials, put them up in your different departments, wherever your public facing or not so public facing locations are. So that way we can kind of spread the word here. Okay. We want people to know that it's there. All right. And sliding in with 2 minutes to spare, I apologize. I can certainly put my email in the chat if you have a question or concern that I'm not going to get to here. Okay. Right. All right, folks. And Sean's got a, okay. All right. Oh, Therese, thank you. All right. Anything else? Questions, Sean? I don't know if you've been following the chat. Anything that you saw there? I'm gonna stop
Yeah,
sharing
so
now.
one other question came up, if who will be on those mobile crisis units?
Okay. Those there are some safety concerns, right? So the goal for the mobile crisis units is right now in New Jersey, it's going to be a bachelor level like case manager, crisis interventionist, as well as a peer support specialist. So someone who has lived experience in the mental health field there. So it's a two-person team, and they're going to be available to respond to the community. So whenever possible, the plan is to go out there without law enforcement, right?
Right, I see Laura has her hand up. Let me see if I can unmute you, Laura. Let's see here. All right, Laura, if you have a question, you can unmute your mic, or if you want to type it in the chat. While we wait for other questions, just want to thank everyone. Thank you, Bill, for a wonderful presentation and so helpful and so informative on this new service. I know there's a lot of questions about it, so appreciate that. Yes, so I will put the link for a website where you can download the recordings going forward. And also, I spoke about that survey, so I put that link in the chat also. But
Thank you so much.
I know. So if Bill wants to hang out, if anyone else has any other questions.
All right. No souls saved after the hour, but I'll hang out for a few minutes here.
Yep. And did you put your email in the chat? Sometimes that's helpful too for
I
people
did. I
if they have
did.
other questions. Yep. Okay.
Yeah. Oh, maybe I didn't. Maybe it went to the wrong group. Let me see. Sorry. Everyone. That's probably the one I want. Okay. Okay. There is my email. I'm in the Rutgers directory too. Yeah. Uh-oh. Apologies that your materials have not arrived. We all know that the federal government sometimes has challenges in operations. But I placed an order and I just got mine not too long ago, and I didn't get any special treatment. So I would assume your materials will be there soon, Petriana. Oh, maybe I put the link in the wrong chat too. Okay. My apologies, folks. Here we go. One more time. Please pardon my technological challenges. There we go. Thank you all for coming. Please tell your friends, right? 24/7 availability.
Yes, and thank you again for a wonderful presentation. And thanks to everyone for being a great audience. And I hope everyone has a wonderful rest of their day.
Thank you, Sean. Thank you so much.
All right, no problem. Bye, everybody.
Bye-bye.